Hi, this is Tim from ChiroUp, and I want to tell you about a new study that came out this week in the European Journal of Pain. It was part of the Optima collaboration. And they looked at headaches that are related to neck pain, something familiar that you and I see on a daily basis. And they had several recommendations. One of them was, we need to differentiate. Is this a tension type headache? Is this a cervicogenic headache? Or is this a migraine headache? And once we have that, then we can take our care pathway a little bit better. The International Classification of Headache helped us define those things. They said that a cervicogenic headache usually had a cervical component that was capable of producing pain, and the pain was oftentimes in parallel to that. The other thing about a cervicogenic headache is usually provocation of the neck problem intensifies the headache. Whereas a tension headache is more of a mild to moderate headache. It's usually bilateral and it's unaffected by those provocative activities. It's just there. So what the Optima collaboration came up with is, how do we treat each of these? And they're treated differently. That some of the things that you and I do are appropriate, but sometimes we need other things. I think the big difference is that for a tension headache, the key is multimodal care. That we need to incorporate exercises for the patient, both global exercises and cervical cranial exercises. This patient may benefit from massage, and they'll certainly benefit from mobilization or manipulation. But one thing that the Optima study said is that manipulation should not be the only treatment used for a tension headache. Whereas a cervicogenic headache can benefit from exercise, and it can benefit certainly from manipulation, but not necessarily a combination of all those things. So those may be treated slightly differently. In some cases, we may need to up the number of things that we're doing to the patient, and the other times for a cervicogenic headache, it may not be as critical to have multiple components to that care. We've created an infographic that summarizes the recommendations from the Optima collaboration, as well as the International Classification of Headache Disorders for cervicogenic tension, and we included migraine as well. You can download that on the link along with this blog, and we hope that you'll check out ChiroUp for the best practice management of each of those disorders. Thanks for watching.